Hello, everyone. Good afternoon or morning or evening, wherever it is you are joining this webinar from. I am, in the meantime, trying to share my slides. Oh, here we are. Okay. I hope everyone can see my slides now. But welcome again to this webinar offered to you by the reference group of the EAPC on public health and palliative care. And today's webinar that we're presenting to you will focus on educational settings and schools. And we have two invited lecturers today. And the first one is Sally Paul from the University of Strathclyde, which is in Scotland, who is going to present us broadly on why we need to develop public health palliative care approaches and educational settings with a specific focus on children and schools. Then Bert Kintins from my own university, the University in Brussels, is going to tell you about his work on compassionate schools and particularly the learning network on compassionate schools that he is facilitating. This will be followed by a panel discussion with Q&A that is moderated by Sarah Jury. And again, like Joanne said in the introduction, I invite you all to really actively use the Q&A function in the Zoom meeting. Do put all your questions you have for the speakers, any ideas, any discussion points that you would like to raise, which we can then pick up on in the panel discussion. As said, we are organizing these series of webinars by the reference group on public health and palliative care. And the aims of the reference group are to promote and improve palliative care using public health approaches, but also to develop a network of interested researchers and organizations or people who are involved in public health and palliative care. And we are organizing a series of activities, sometimes in collaboration with other organizations, such as this big activity that is taking place in 2 weeks from now, which is the Public Health Palliative Care International Conference that is taking place in Bern, where also educational settings, so today's focus, will be prominently featured. But we also organize a number of other activities. And one of the activities that is forthcoming in the next year is an activity that I have the pleasure to announce you now, and is taking place in Victoria in Canada, which will be the 4th International Research Seminar of the EAPC Reference Group on Public Health and Palliative Care. So organized together with our Canadian colleagues. Then every half a year, this reference group is organizing webinars. The next webinar will be on international and cross-national comparisons in palliative care research, with as speakers Agnes van der Heijden, Barbara Gumsch, and Tanya Pastrana. In the second half of 25, we'll have a webinar on death literacy. We also organize a number of activities and webinars in collaboration with the Compassionate Community Center of Expertise. But Sarah, at the very end of today's webinar, will tell you more about those activities. An important way to engage with the reference group is through the newsletter and to our website. And you can visit our website, and I put the link here. And if you want to keep up to date with all the activities that we're organizing, with some of the output, with the latest news, do sign up for our newsletter, and you can use the QR here to register for the newsletter. But as said, today's focus of the webinar is on schools, on educational environments. And you may wonder, why do we focus as public health palliative care approaches, and why do we focus those on educational settings? And of course, the two speakers today will tell us much more about that. But two reasons why we think these are important foci for public health palliative care. The first one is about numbers. Have you ever thought about how many people in a school or educational environment are every year confronted with a death, with dying from serious illness, with family caregiving, with loss? And we have actually tried to calculate those numbers for our own university, the University of Brussels, where we're doing a compassionate university program. Our university has about 22,000 students and about 4,000 staff members, because an educational environment is also composed of teachers and other types of staff. And in our university, and try to think of your own university, what would these numbers look like? But in our university, with all the age distribution, of course, it's a relatively young population, but there will be, nonetheless, every year, 16 deaths that happen, which 8 from serious illness. About 1,800 people will be providing family care for someone with a serious illness. And they would have to combine this with all the challenges of studying, of doing exams, and finding a balance in it. About 2,400 will be confronted with loss of a close family member, and we're not even talking about neighbors or friends. So these are enormous challenges, and they happen in the context where we are living and where we are studying. So it also really warrants or demands some interventions that support these experiences. And beyond these numbers, the second main reason is more an anecdotal story, a personal anecdote, where I have a 5-year-old daughter myself. And about a year ago, all the parents of the school received an email from the principal that a father of one of the students had died, and there was a possibility to sign the funeral book or to write a few words in that. And in that period, we were, and Bert is going to tell you more about that, we were working with the community of Herzelen on this project of compassionate schools. So I wrote an email to the principal talking about this project, and then she immediately invited me to hear more about this project. So I told her about how in this project the schools had developed a number of policies and procedures to address these challenging situations, where they had composed trainings, but also educational materials, making sure that we could improve the personal skills, the confidence to deal with these situations, where they had involved the existing well-being services in the schools to also help with these situations, and where they had developed a number of activities to create a supportive environment for such situations. And the principal was really fascinated with all these ideas, and immediately picked up on some of the ideas, ordered some of the pedagogical materials. And then 2 weeks after, she contacted me. And tragically, another father in the same class had died. And you can imagine what an exposure that gives to all the children in the class. But then she really thanked me for pointing her to all these materials and possibilities, because this had definitely made a difference. So I think it illustrates where these public health palliative care approaches can really make a difference in such situations that happen quite frequently. So it is my pleasure now to introduce the first speaker of the webinar, and I'm going to stop sharing and let Sally Paul share the screen. And Sally Paul is a senior lecturer at Strathclyde University in Scotland, who has a background in social work And she has done extensive work on compassionate schools, death education in schools, and she is presenting on her work.
Thank you, Joachim. I'm just making sure I've got my slides in place. I will start. Hopefully everybody can hear me well. Yep. Actually, before I start, I'm just going to double check that I have pressed the correct buttons, because I've got a video clip, and sometimes in the nerves of the day, you get that wrong. So I'm double checking, and I got it right, so I didn't need to myself. So so thank you very much for having me here, and thanks to Joachim for that introduction, and to for setting the context of what I'm about to talk to you today. The work that I'm talking about is a chapter in the Oxford textbook of public health palliative care. And for anybody that's heard me talk before, some of this will be very familiar to you. I've been involved in this area of work now for 10 years. So I do apologize if you've heard some of this. And if you haven't, then welcome to the world of some of my research. Prior to working at the University of Strathclyde, I was a palliative care social worker. And the reason that that's important is because through my day-to-day practice, I was working in the community with young people who were bereaved or were about to be bereaved. And often we got calls upon from school communities about what should we do, how should we help? And that really led me down this research track, but also into the field of public health palliative care. And for those of you who are not so familiar with public health palliative care, I'm just going to go over some of what the key principles are. So public health recognizes that health, and in this context, health means a healthy death or healthy dying or grieving well. Public health recognizes that that type of health is not determined by clinical need alone. Therefore, a public health palliative care response repositions death as a social issue rather than a medical issue. And in doing so, gives focus to the variety of social experiences that shape how people live and die with serious illness, how people provide care to others, and how people grieve. And you can see that diagram on the right of my screen there, which shows the various influences on a person's experiences of palliative care, of caregiving, dying and bereavement. So public health palliative care very much identifies those different domains. It identifies families, friends, communities, schools, workplaces as being a key component to improving experiences at times of death and bereavement. And palliative care services obviously are an essential part of that approach, but only one and often small part. So it's really important that we look at those other areas and think about how can we improve people's experiences of dying and grieving. Public health palliative care also looks at the social and structural determinants of health. So where people live and how they live, and the social and economic factors that might shape their experiences of being ill or dying of grieving, and works to address those in a way that provides more equity of care. And through that, it's very much committed to early intervention, harm reduction, prevention, and sustainability, and use a whole range of approaches to meet those commitments, with health promotion being one of those, education, ecological approaches, and so on. But what does that mean for education? So I'm going to share this clip with you just to provide a bit more context and to build on some of what Joachim's already said. And some of this might be emotional, so just to prepare you for that and to look after yourself. I'm just going to move to the right.
When I was really young, I didn't understand how my mum died and what caused her to die. And I would say, was it my fault?
I didn't know if it was me who was in the wrong, like if it was my fault that she died, and it made me feel guilty for anything bad that had happened, if we'd ever had like arguments or I was naughty. The fact that no one would talk to me about it, it created this sense of I should feel guilty, because if no one's talking to me, then what I'm feeling must be wrong.
When she first died, I didn't really know who I could trust because people didn't understand. I didn't tell many people for a while because I just found it hard to bring it into conversation.
Friends, you know, they can't give you the same support. They don't understand the experience. They don't understand what you're going through. It was just me trying to sort of be to myself and not make them stressed out.
I'd just be like in tears for ages because I just hadn't spoken to anyone about it for so long.
My school classmates were told they couldn't talk to me about it, and so all the way till I was 11 and left primary school, no one ever spoke to me about my mum.
When people would say like, oh, is your mum picking you up or anything like that, at the early stages I used to just panic.
One of my teachers asked me how my mum was coping and I had to tell him that she died.
It made me feel that no one cared.
Through secondary school, I got bullied because of it.
And it was quite difficult to start settling in and go straight back into doing my GCSEs.
People would start saying, oh, your dad this, your dad that, oh, haha, it's funny.
Then they were saying to me, like, 4 months after she died, I should have been over it.
I could not wrap my head around why kids were saying this, and it happened, this would keep happening. As it was year 8, year 9, year 10 and 11, so 4 years in living through that. It was very, very hard.
Tried to mask everything by doing schoolwork and just focusing on that and not really thinking about how I was feeling much. And just tried to think, well, I'm okay, as long as my grades are okay, then I'm doing all right. But it's not as easy as that.
I think what that video clip there shows really well is that death and bereavement is really hard. Those experiences are very much shaped by the environment. What those young people talked about is how their own personal knowledge, the access to information that they had, shaped how they engage with that death, not having enough information or the right information at the right time, but also that the people around them, their peers, the staff in the school, when they didn't have knowledge about death or grief or dying, that shaped how they were able to provide support or unable to provide support. And actually, the communication and the procedures around that in school, for example, the story of the girl who said that the teacher didn't know that her parent had died, affected then how she in turn could engage with that staff member and her school journey. So clearly the school is a really important environment for shaping how children engage with those experiences. And just as Joachim highlighted, these children aren't in isolation, and actually these experiences are much more common than we think. It's estimated that 2 to 8% of children aged under 18 are young carers, with some figures as high as 22%. And over half of children have experienced a death by the age of 8, and that by age 10, that rises to 62%. And those studies there are based on national representative sample sizes of data. We don't have that data in terms of the experiences in higher education, but Joachim gave us some really startling facts about his own university, where 22,000 students, I think, experienced a bereavement and 4,000 staff members. And of course, when we look at the data, so much of it talks about the problems and the risks associated with those experiences and the need to really provide meaningful and appropriate support in a timely manner. And as you can see from the diagram there, most people just need a response from existing networks, and a few people need that specialist support. And what we're really talking about here today is those bottom 2 bits of the triangle, you know, that most and that some, getting that right so we can help the few that actually need the specialist support. And for children after the home, school communities are viewed as one of the key protective factors. So it's really important that we give them attention. So why are school communities a critical context for enhancing health and well-being at times of serious illness, caregiving, death and bereavement? And we're talking about schools here, but universities absolutely are relevant. Both schools and universities are already viewed as key sites of health promoting activities. If you think about healthy eating and exercise, a lot of that education takes place in schools. That idea that if we can improve students' knowledge around that, we improve their ability to learn, and that education will go on to improve their future health. Also, schools are that interface between public and private lives, where at home it's private. When you come into the school, it becomes public and shared in ways that are unhelpful or helpful. And that can provide a real opportunity to intervene in a way that is helpful and appropriate. And there are multiple ways that school communities or education communities more broadly can impact our experiences of dying and bereavement. One of those, which is getting a lot of attention now in the literature, is around building death and grief literacy through education and awareness raising. Schools also offer routine and continuity during what can be a very difficult and complex time. It also offers formal and informal support networks. Sorry for that error in the slides there. It can be a site that provides advice. It has existing network with peers and family, so a good place where we can get advice and guidance out. It offers a steady person. People are known to that young people to talk to, and that was often a key part of my job in the hospice, was not actually working with the young people, but working with the people that they already had relationships, because they were the best place to provide the support rather than the specialists. And most importantly, because they know the children, they can provide timely and targeted support. They're aware of where children are coming from and what support might look like to them in that particular context. So what does a model for public health palliative care in education look like? So one of the things that I did in the chapter, and building on some of my research, was to look at what already exists in schools, what are health promoting schools, and how can we apply that in a way to palliative care. And the core features of health promoting schools are over these 6 domains in terms of health policies, health skills, social environments, the physical environment, community relationships, and health services. And what that means when we think about that in the context of the work that we do in palliative care and bereavement, health policies means that we have to include serious illness, caregiving, death and loss within those. And that relates to the curriculum. What is the national curriculum? What is the local curriculum in schools, depending on the education setup in those countries? Does it pay attention to death? Does it pay attention to grief? And if not, what are the opportunities to do so? It relates to safeguarding and health and well-being, how we look after our children. It relates to critical incidents, and a lot of the research that I've done on kind of bereavement policy, often there's already an existing critical incident policy that looks at sudden or tragic events. And that's where bereavement is mentioned, but of course, bereavement isn't always sudden. So how does it link with those existing policies? But also looking at human resource policies such as carers leave and bereavement leave. Do they attend to these experiences? And if not, what else needs to be added? Personal health skills, that's around opportunities for developing death and grief literacy, providing death and grief education, as well as building on personal skills that are linked to communal experience. And when we think personal health skills, it's not just about yourself and looking after yourself, it's about seeing yourself in the context of the school community, as a neighbour, and your role in supporting others. The social environment, in terms of having that culture of openness and empathy so we can engage with each other at such time. The physical environment, that we've got spaces where we can have difficult conversations, where people can go if they need to grieve alone. Community relationships, connecting with what already exists in the neighbourhood, working in partnership to support the young people and the families, but also about being known how to access expert support and advice when needed. And lastly, health services. What that means for public health palliative care is ensuring that we have established partnerships with local palliative care and bereavement care services, so between those services and the schools and the carers group, and that clear referral pathways are in place when we need advice, but also when we need the top of that tier in terms of specialist support for those few who need it. So the key ideas for that model, and this is a model that I've adapted from the Irish National Framework for Adult and Childhood Bereavement, but I flipped it based on a presentation that Professor Sama Aoun did, who I think is listening today, because I think it's really powerful in terms of what we're thinking about when we think about a public health response in the context of schools and palliative care. We're focusing really on that universal support and ensuring that all children and young people and all staff who work in schools have information and education about serious illness, death and grief, that they know that death is a normal part of the lifespan, loss is a normal part of human experience, but they also know about grief, what it looks like, what it might feel like. And that's really important so that at times when you're grieving or a death is happening, you know what feels normal, but what doesn't feel normal, and when to get support. And then thinking about the other bits of the last model that I showed about having access to information and staff training so that we can provide that support to some who will need that bit of special input, but also those networks in place so we can access the specialist service that I'm sure many of you provide when that's needed. And what does that all mean in practice? So to finish, I'm going to highlight two examples, and it's actually a really beginning area of practice development. And certainly in the UK where I'm based, there's lots of practice examples that exist that all look slightly different. And I'm going to talk about two that are in Scotland currently. The first one relates to death and grief education, and this is the work that I was involved in the initial stages of being a palliative care social worker through my PhD. And this actually involved the hospice going to schools and saying, look, we're aware we're getting communities. What can we do? How can we use our expert advice to support you and to do your jobs well around bereavement and education, and to use our expertise in the right way and with the people that really need specialist help? And through listening to the children and young people and the staff, several innovations were developed. And one was the Resilience Project, which is a discrete death and grief education programme aimed at pupils aged 9 to 11 years old. The lessons answer the children's questions that they had through those initial kind of data gathering phases about how we can help. Lots of questions came up about dying and grieving, life cycles that are answered through these lessons plans. And those questions related to life cycles and lifespans, living and dying, what happens when the body dies, organ donation, funeral customs, and grief. And that has been mapped by the school and myself against the national curriculum, which makes it much easier to embed as part of normal curriculum delivery. That's been going on for 10 years now and served over thousands of children. But that programme doesn't sit alone. It's supported by a wider resilience programme where the teachers receive bereavement awareness training, and they incorporate a range of events throughout the year that means that death is part of the culture, that death is spoken about, and some of that's through existing things that happens, like remembrance days, making a point to talk about that, through natural transitions within the school that involves loss and change. They also have a bereavement policy, and the hospice, in working with the school, have adapted its fundraising materials, which is a big part of the hospice culture in the UK, to ensure that they don't just go out to ask for money from the schools, but when they go out, they also talk about the role of hospice in end-of-life care and use that as a teachable moment to teach children about dying and dying well. The second example is the Bereavement Charter Mark. So in Scotland in April 2020, there was a bereavement charter for all children and adults, where bereavement is very much viewed as a human right, with the aim of Scotland being a place where anyone experiencing bereavement is treated with compassion, empathy and kindness, with their wishes, choices and beliefs recognised and respected by all. And employees, it first started off with their workplaces, so employers could apply for this charter mark if they meet certain criteria. And this year we've adapted that for schools, and schools can get the bereavement charter if they meet at least 4 of the following criteria. And those criteria are listed there. I won't, in thinking about time, I'm not going to read them all, but what this aims to do is kind of have a national approach to encourage schools to start thinking about these issues, to start developing this work where they see best fits with their school community, where they can kind of bring it in a way that works for them without feeling too big a jump or too scary. So where to start? Because that's often the question we get. Like, we know what it is in principle, we know what we should do, but how do we start these initiatives in school communities? Hopefully what you've seen from the examples there is that there's multiple entry points. And if we use the model of health promoting schools, we can also see that there are multiple entry points. So if you work in health services, maybe the entry point for you is connecting with your local schools and asking what they do and how you might enhance that or build on that. What we also know is there isn't a correct way, that it can mean different things to different schools depending on what's happening within that school community, but it's very much about the school reaching out and us as palliative care professionals reaching in. And I think the example that Joachim started off is a good place to end, because often these developments in this area do start by responding to what's happening and building on these individual experiences to think about the community as a whole. I will stop there because I know that Bert is going to build on that a little bit more in terms of the European Learning Network. So thank you.
Thank you very much for that nice overview, Sally. I think this really illustrates well how schools can really make a difference when it comes to supporting these experiences, but also what we all can do to focus on schools. And indeed, you have made the introduction to Bert, who is going to be the next speaker, and he is going to present more on his work. And Bert has done a lot of work in compassionate cities, but in one of the compassionate cities, the focus has been development of compassionate schools. And Bert is a nurse by background. He is actually very soon also defending his PhD on compassionate cities. And maybe good to know is that Bert has just today come back from parental leave, because Bert has just become a new father. So congratulations to Bert, and this is, I guess, your introduction back into the work. So Bert, the floor is yours.
Thank you for that very unique and kind introduction, Joachim. I hope everyone can see my slides. I believe that is the case. As Joachim mentioned, I have a background in nursing, and I've worked as a PhD researcher on the development of compassionate cities. And within one of those cities, there was a very high focus on the development of compassionate schools. Apart from that, I'm also chairing a learning network on compassionate schools together with my colleague Sally Paul from the University of Strathclyde. And I would just like to share with you a few experiences of from myself, in the Compassionate School project, but also from the Learning Network on Compassionate Schools, and why we believe it is necessary to have such a learning network. I'd like to start off by the beginning, by the start. Compassionate schools are places that recognize that serious illness, death, dying, loss, and caregiving are integral to human life, and therefore life in schools. A lot of compassionate schools are focusing primarily on students, but we have to acknowledge that staff are part of compassionate schools as well. In some way, a compassionate school is a compassionate workplace, and also staff, teachers, but also other school personnel are experiencing end-of-life situations. Luckily, not on a daily basis, but this is happening very often in everybody's lives. So as well in the life of teachers and staff as in the lives of students. So compassionate schools pay attention to both students and staff. They work towards the active integration of these teams in schools through activities and actions. And I believe the word that is important is the active integration. This is not something that happens spontaneously. You will need to actively develop activities and actions through which you can become a compassionate school. And later on, I will give some examples of what such activities may look like. Compassionate schools primarily aim to reshape our attitudes around the end of life, build our knowledge, and build our skills so that we can change the experiences once we are facing end of life experiences. And the reshaping of those attitudes, I believe it is really necessary. If we look at our societies today, we can acknowledge that there's still a certain level of taboo residing around end of life situations. If you think about talking with, for example, your parents about their own end of life, or when you have to talk with a person who's been recently bereaved, you can see that these are sometimes situations that are really difficult, that we lack the skills, and sometimes we do have skewed attitudes about what the situations are like. And this is the same in schools. When I was working in the compassionate schools, I very often heard the contention from teachers that they wanted to shield students from such bad experiences, from end of life situations. But if you come to think of it, it doesn't really make a whole lot of sense. But Sally already showed in her presentation that children are already confronted with end of life situations. As a school, you can make the choice, either you're going to discuss it or you're not going to discuss it, but these events will take place regardless. So we can reshape those attitudes, the attitudes of teachers who sometimes have a skewed vision, but also of students who will become adults later on, and give them attitudes that are different than the attitudes we have in our societies today towards end-of-life situations. There's no real predefined development program. Maybe that would be an ideal situation for you if you would like to develop a compassionate school, but the development of a compassionate school really needs to be tailored to your local needs and your available resources. A certain acute event in a school can be a really good entry point in starting the development of a compassionate school, because it shows the need very profoundly that something like that is needed. If a child's parent has committed suicide, for example, this can be an entry point to develop a compassionate school. And this is something that happens in one school, but maybe not in the other school. This one school can really feel the need that they need to work around suicide, for example, that is very specific to this school. So the development of a compassionate school really, really depends on the needs that you have in the school, and of course the available resources. It's not going to develop spontaneously. You need people who are working on this. And if you have one person or 5 persons working on this makes a huge difference. It's a continuous process. There's not going to be a day when your compassionate school will be finished. You will have new staff and new students. This is something that you need to keep continuously developing. There are new activities and new actions that you can undertake that haven't been tried before, that you haven't tried before. So this is something that needs to continue development. And as promised, I will show you just 3 small activities that took place in our compassionate schools. And from my personal involvement in the development of compassionate schools, I experienced how teachers and people who desire to develop a compassionate school are very much in need of inspiration on which activities to organize. A question I very often received is, what does a compassionate school look like? I mean, we understand the theory, but what does it look like? And although there's no set list of activities and actions to undertake, and everything depends on those local needs and resources that you have, some inspiration on what has already been done in other schools can always help. So I have 3 activities here, and the first one on the left, these are just books, right? If you go to a primary school and you want to talk about the suicide of a parent, there are some books available that can guide you in this process. Having a conversation eye to eye with a child can be very confrontational. A book can really facilitate this process. Even a 7-year-old, for example, who doesn't even know the concept of suicide, there are books available. You just need to look for the right books, and you can find it online on some websites with some very good information from compassionate schools or compassionate communities that will give you a list of books that you could use. The second one, it's in Dutch. The first one says, "I support you," and the second one says, "I wish you strength." There were actually 2 goals in developing these cards. These are small cards that children in primary schools developed. On the one hand, it stimulated these children to talk about the end of life, about a topic that many of them have experienced, maybe not really in a parent or in a family member, but most of them had lost a pet, for example, so they knew the concept of loss. So they could discuss this while developing the cards. And on the other hand, of course, the cards could be printed and were given to people in need of support. And on the right-hand side, we see a teacher trainer who's training teachers on how to talk with children about the end of life, how to talk with them, what words to use and what words you should try to avoid. For example, teachers sometimes use euphemisms to talk about the end of life, that somebody is just sleeping very deeply. No, the trainer would say, death is a final experience and you need to be open and real about this with children. So educating teachers who've often not been educated on this topic during their training can be a very useful step. I want to give a very small and brief theoretical background. I'm sorry if you're already familiar with the concepts of compassionate cities and communities, but compassionate schools build upon this theoretical background. Compassionate cities, the whole idea was launched in 2005 by a sociologist, Alan Gallagher. I'm just sharing it for you. If you want to take some notes and look it up later on, you can. It's a book that was printed back in 2005. Compassionate cities and communities are places that recognize that serious illness, death, dying, loss, and caregiving are integral to human life and therefore community life. It's the same as for schools. Death, dying, loss, and caregiving, they take place everywhere where people meet for social reasons, for professional reasons, for hobbies, for example. So it takes place everywhere where people meet. It doesn't make any sense not to target those areas. Compassionate schools are one of those areas we target within actually any city or community. As I mentioned, there is no sector that we should skip. It happens everywhere. And it's guided, just for background information, by the Ottawa Charter for Health Promotion, which stimulates people to take control of their own health and also health at the end of life. But a learning network on compassionate schools, and why did we believe it was necessary to start a learning network on compassionate schools? Well, first of all, there is a disconnection between scientific research and then the practical implementation of the scientific research. I'm a researcher, my colleague Sally Paul is a researcher, and there's a lot of very good research available on grief and loss in children in schools. And there's also growing literature on compassionate communities and compassionate schools. But it's really difficult to start implementing the learnings from this scientific research to practice. And that is why a learning network can really facilitate this process. There's also a lack of connection between schools. I learned throughout my research that a lot of schools are really doing very good things, but there is not a lot of connection between those schools. They're not stimulated to share their knowledge, to share their learnings, and to connect with each other. So a learning network bringing together people from different schools can really facilitate this as well. Schools are really complex environments. Things can happen in schools that are unpredictable, that change the whole process of the year. Teachers have a lot of responsibilities in schools, and I very often heard them tell me, I've trained to be a teacher and now I need to teach about the end of life as well, and not just the end of life, but I have so many responsibilities. So how should I cope with this? And there's really not one good answer, but the end of life is something that is applicable, for example, to many courses they're already teaching. Maybe biology or religion or even sports classes. If somebody has a serious illness, cannot attend a sports class, you can find an entry into a conversation about that topic that way as well. As I mentioned before, activities that take place in one school cannot always be copied to another school because every school is different. Schools have different cultures and different social environments. And sometimes things just happen in school that are unpredictable and that may make something much more difficult to implement or much easier to implement as well. A learning network, well, we hoped, or we still hope, that it increases the capacity in schools, increases their capacity to work around end-of-life topics. How do we develop this learning network? Well, first of all, we had some seed funding to realize some really, well, some small but very meaningful activities. And one of the first things we're doing right now is the development of an inspirational guide. And we'll talk a bit more about this in a later slide. We're also giving a seminar at the PHPCI conference, which has been introduced by Joachim in the beginning of the seminar. And then still we want to develop a book, an edited book on compassionate schools, a book that will be spread and that people can use to develop their own compassionate schools. And we are lucky to have attracted a number of partners from different countries. We have partners from Belgium, UK, Netherlands, Greece, Italy, and Spain. And this diversity is really important because the educational context looks a bit different in Belgium from Italy, for example. So we really need this diversity to be able to develop something that is applicable in different countries and hopefully in a lot of other countries that are not yet participating in our learning network. But then this guide for schools. And why did we want to develop a guide? Why do we think it's a good idea? Well, schools really, really are in need of inspirational and accessible material. They're not really looking for a thick book where you need to go through the pages to find the information you need. They need something very small that they can grab and start to work with. And an inspirational guide that is very short, but gives some good information on how to develop or start to develop a compassionate school was something people really desired. And this is why we are working on this. It is practical, to the point, and of course, inspirational. But it needs to be practical and to the point because this is how teachers are trained. Teachers are trained to be practical. That is what their job content is like, and that is what they like to do. So we are giving them actually something that fits and that matches the way that they're used to work. It needs to be diverse. We have primary schools, secondary schools, but also higher education. We need to give information that is relevant to all types of schools and not just one school, of course. And by talking with people who are participating in our learning network, we came to learn that they're really desiring a website. And this is something that we want to build later on, a website, because it costs a lot of money, of course, to build a website. But we feel there's a real need and a real desire for a website with accessible information that can be adapted and tailored, not like a book. A book, of course, it's printed and it's just there, but a website that we can change and put new ideas and new actions and information on that people can access at any time. What I still want to share with you is some learnings I have from working in this learning network, but also working in the Compassionate Schools project. And I think this is very useful information if you want to get started, if you want to bring together a diverse group of people as you would do in a compassionate community or in a compassionate city, sometimes in a school as well, if you want to bring in the parents, the students, the teachers. So you can start with a quite diverse group of people, but how do you do this? How do you start working with a diverse group of people? And in our case, in the learning network, we have a group of people with different backgrounds, and we are not paying them to participate. People are doing this voluntarily. Something that really facilitated some people's participation was giving them a mandate from their employer. We went to talk with a number of employers of people participating and asked them if it would be okay for their employee to participate in this learning network. And this was really important because otherwise this would be work they would be doing on top of their existing work, or maybe they wouldn't have participated if that would be the case. Now their employer can free up some time for them to participate, which is of course beneficial for a learning network. Secondly, and this counts for every diverse group of people that you bring together, you need to ask yourself, why are people participating? And people participate for a number of different reasons. One of these reasons might be material. People may participate in a learning network because they just want a how-to guide and to use it later on in their own schools or to spread it within their country. But maybe people participate for social reasons. They want to connect with other people who work in schools, other researchers perhaps, and just have this social interaction and exchange of information. But people may also participate for altruistic reasons. Maybe they just want to create better schools and better end-of-life experiences in schools, or just want to create a better world. It doesn't really matter why people participate, but you need to find out why every person participates, because you need to give into that. You need to give them what they want to keep them motivated. If you're leading a group like this, you are facilitating the development. You're not making the big decisions. Of course, we have our seed funding and we're limited by our possibilities, but the knowledge is in this group of people. I'm a researcher and Sally Paul is a researcher, but we're bringing together people who are working in schools. These people have the knowledge from practice. This knowledge is not present in me, nor is it present in my colleague Sally. We are there to facilitate this knowledge exchange and build from it. And of course, it's really important to always provide inspirational material. People want to learn from what other people are doing. So giving them some ideas, giving them some actions or activities that have worked in other places that might be applicable to their area as well. It always works really well. If you have a diverse group of people, you need to build some cohesion in this group. And one of the things that you can do is build towards this common goal. And this goal is then developing a how-to guide, for example. If people start working together on this common goal, they will be more motivated, and then they will see the results of what they're doing. And I put a sentence there because I find it really important. And I also noticed this very much when working with teachers. Researchers sometimes tend to discuss a lot, and that is good because we want to be prepared, but you need to start with action as well. Especially teachers who are used to activities, they need this action to stay motivated. So discussion is super important, but don't forget to start with actions and don't wait too long because people will get demotivated. It is important to see the results of your discussions and not just discuss. And as always, when you bring together a group of people, there's different levels of participation. Some people are there just to follow along and read your emails. Other people are really participating and in the group, and that's totally fine. All profiles are welcome. If people just want to see what we're doing and just follow from the background, I think that's perfectly fine. They can be inspired and start doing something by themselves. So different levels of participation are always present and you can benefit from each level of participation. You just need a couple of people who are motivated to join. I'd like to end with this slide, and it's the next steps for our learning network. We want to attract additional funding. As I said, there's a high desire for a website. We saw this among all people who participated. They really, really wanted or desired a website with this accessible information on compassionate schools on which they could share their own activities, but also learn from other people's activities. And I'd also like to address you if you're interested to join our learning network or be interested in what we're doing, for example, to distribute the guide we're developing to a network of schools, because the guide will be small, as I mentioned already, but it will be translated in different languages. Perhaps you want to help us translate it in Japanese or any other language that you speak that is not present in our learning network, or you just want to help distributing the guide, you're most welcome to contact me and I will give my email address. Maybe you're good in attracting funds or you know some funding sources, please do contact us as well, and we can work together on something. Or if you just want to follow along what we're doing, as I mentioned, that's totally fine. You can just follow our mailing list and read our emails. And if you feel a need to join, you can just contact us back, and you're always welcome to join our meetings. Just send me an email. Here's my email address, and I will make sure to include you. Thank you very much.
Thank you very much for telling us about your work and also the learning network that you are coordinating. I am now handing over for the discussion to Sarah, who is going to moderate all your questions. And I noticed that there's not that many questions yet in the Q&A, so I'm going to reiterate my suggestion that you use the Q&A to put anything in there. If you have discussion points that you would like the panel to pick up on, if you have some very preliminary ideas, if you have some questions for clarification, do use the Q&A. I guess the good thing is that it can be anonymous if you want, but I am now handing over the discussion to Sarah.
Thank you, Joachim. Indeed, not many questions yet in the Q&A, but I would like to introduce the first question. And that's from a colleague from Japan, and who's really saying that there's a growing number of young carers, and he agrees that education from an early age is necessary. But what he asks is, how can we do it in a country where having a view of life and that is not common? This is very important for countries we're talking about that is not yet common, such as Japan. I don't know, Sally or Bert, what would you advise in countries such as Japan?
I'll start. I think that's a really interesting question for a number of reasons. I think certainly when if we think about cultural the context of our work, and certainly my work, it's been, you know, it's in a Western country where children have been sidelined in this kind of view to protect them. So let's protect children from harm and not include them in aspects of death and dying. And that's what the literature would certainly say. And I think Compassionate Schools attempts to address that. And I'm not as familiar with what that looks like in Japan. It may be that in Japan you don't talk about death, but you might still include children in death. Because it isn't just about talk and discussion, it's about inclusion and access to information. So I guess starting where you are culturally is just so important for that, and starting where the children and young people are.
I would like to add to that something that came up in my mind, and something that's being used in a lot of compassionate cities around the world, is trying to find a soft entry into a topic that is very sensitive, such as the end of life. And what you're describing in Japan, to some extent, it's applicable to most countries. I think it's sometimes really difficult to talk about the end of life. And many compassionate cities are, for example, using the arts to facilitate conversations, not necessarily only conversations, but if you have a group of children and you just let them draw something on the end of life from their own experiences, maybe even without having a discussion, but making them reflect on their own experiences through the arts, I think this can be a soft introduction, so to say, about a very sensitive topic.
Thank you both. Then I would also like, another question that I received by email is how to approach a given school and what ages are best to start. Do you have an idea on that?
That's the $60 million question, as we would say here. Yeah, I think it depends who you are, I guess, and where you're coming from and what your interests. And what we've learned from the European Learning Network is that starting with your interests or your idea is the first step. So maybe you've got a school that you have a good connection with, and that you know some of the staff, or you know there's been an experience there, and that would be the place to start. And I would start with that rather than thinking it has to be a certain age and a certain school. So yeah.
If I look at my own experiences, I think it can always be a very good entry to relate to something that they recognize. You can always ask them if they've experienced certain situations around the end of life, around caregiving, about loss. And the answer will always be yes, because there's no school that hasn't experienced it. But if you look at their specific situation, you can maybe work around that specific topic as a starting point. And I've also experienced that schools, and I don't know what it's like in other countries, but in Belgium and in the UK, a lot of school staff are quite burdened with their work, separate from compassionate schools or end-of-life work that we're asking them. So I think it can be beneficial not to present it as a very large or big project, because this may intimidate people who, well, I've never heard of it. You really need to tailor it to their needs and their resources. And if they're already quite burdened, we need to facilitate the development of compassionate schools. And that is also why we are developing this guide, not letting them start from a blank page, but giving them at least something they can use and start from. So sometimes it can be really good to just start with one action and maybe skip the whole, we need to develop your school into a compassionate school, but let's start with one action. What can you do? And it doesn't have to be too big. You can have just a conversation with the teacher and students in class, and that's already a great success if that worked out. So start small and build from your confidence that you build.
Thank you for that. And then I have another question, and that is related. It's a second question. Would you create a group for social workers, students interested in this topic?
We're happy to invite social work students along to the group that we've got, and also happy to explore other groups that might sit outside of that. I know, for example, in the UK, there's interest in, we have a group specific for palliative care social workers, but not specific to kind of public health approach. So I think there is appetite and room for that. But email that and come to the main group, and we can go from there.
maybe building further on the other questions from Nadine, is she works in a school with a strong Muslim community. And yeah, she's asking how we look at the religious beliefs. Are there sometimes a barrier to start about these conversations? What would you advise of? What is your experiences with working in compassionate schools?
Mhm. In the schools I've worked in, we didn't have a particularly large Muslim population, but I think something that you always need to do when developing in a compassionate school is listening to the students and involving them in the development of the compassionate schools. We shouldn't make the mistake of developing it for them. They have a voice, they have a preference, and I think if you strike the conversation with them and listen to what they would like to see and what their needs are and how they would like to give it shape, I think that's something you should always do regardless of the population. But if you have a Muslim population with maybe very specific taboos, I would certainly say just start a conversation with them and ask them how they would see the development of a compassionate school.
Yeah, and I guess I would add to that. So some of the training that we did as part of the resilience project, when we spoke to staff about what were the barriers to talking to children about bereavement, it was often that they didn't know the religious faith. So they were too scared to say anything because they didn't want to say something that might contradict their religious beliefs. And so they wouldn't say anything at all. And actually, you mentioned the resilience project there, and there are ways in that actually we can talk about death without talking about faith, and as Bert said, be led by what children believe. Also from some of the research that I've done looking at where death education might fit in, it does fit in quite neatly within religious education, and certainly in the UK the religious curriculum teaches about all approaches to death, whether that be Roman Catholic or Muslim or Sikh, and so often has been an entry in to talk about death and funeral customs in those specific concepts.
Building on the aspects of the compassionate schools, we have a very nice question as well on, would you advise a minister of education to promote a compassionate week in every school in a country?
Yes.
That's short and sweet.
I think definitely, maybe it doesn't need to be a compassionate week, but at least I would try to to talk with the minister and let them pay attention to compassionate programs in general. But I think he is then talking their language, and talking to a minister, they're interested in the economic story, interested in policy results. So I think that's where the scientific research may really help you and show you what is possible when you invest in a compassionate program in general. And the minister is somebody who can make big changes, can give you access to funds. So whether it's a minister or a mayor or the local alderman, I think you always need to try to involve them if you want to expand your project. They can just facilitate so many things. We're talking about compassionate schools, but if you want to extend to a compassionate community, stupid example, you need a room to have meetings. This can be facilitated by your local politicians. So always try to involve them and let's see what they can do for you.
Yeah, just to build on that, I think the importance of leadership is really key in getting something started. I like the word promote rather than mandate. I think, thinking again about a Scottish context, the idea of making something compulsory, although we can think, yeah, that'll get things done, you can also do things quite poorly if you don't have the right training, the right access to information. And so it is important to take schools on a journey and to get people to buy in. And as we've already spoken about, that doesn't have to be, this is a compassionate school. It can be a slow growing process through a range of small activities that build up until everybody's on board.
And maybe I would like to add something here as well, because I do think that the concept of something like a compassionate week does indeed provide an advantage. And I think the advantage really is in the fact that it provides a bit of a framework or umbrella to do activities under. And what I mean is that, like, in the absence of such a framework, what would typically happen is that a certain group in the school, in the educational setting, would be working on compassionate policies and would be mostly focusing on developing policies and developing procedure. And I think what is really important in actually creating a supportive environment is to involve and to include the community in developing their own ideas and coming up with spontaneous action and really working from what they feel is useful, is needed. And if you provide a framework and you say, okay, in this week, there's a series of activities that you can all plan, and we want you to develop these ideas, this is really giving the context and the space to develop them. So that's why I think festivals or thematic weeks are really a good example, are a good idea, and really will lead to different involvement of the community than in the absence of it, and when you're just working with a steering group or a core development group or just a leadership who is developing it. So that's what I think is needed. You need the framework, otherwise I think it also risks to become this kind of secluded secluded discussion.
Indeed, and I think that's also what Samara Un explains about an art competition that kids could draw, how they felt when losing a pet or someone, and that already opened up the conversation. And then, okay, and thank you for the idea of a compassionate week. Perfect, Nadine, very nice. And there is another question related to in Asia regarding the bereavement charter or the compassionate school charter. Maybe we can answer that later, Bert and Sally. And sorry for the noise. And then I'm already looking to the other questions. Then maybe looking at, yeah, I think that then you have Christine Irvine who's asking a cluster of schools of supporting each other to become compassionate schools through a self-led approach. Bert, maybe you can comment on how we evolved as a learning network at the beginning. Maybe the process, how you can start with it. Maybe that's nice also to share.
Yeah. So before we had a European Learning Network, I had a small Flemish Dutch, Flanders is the northern part of Belgium, Flemish Dutch learning network on compassionate schools. And well, if you want to get started, it's always the easiest to contact the people that you know already. And of course, you risk being in a homogeneous group with the people you always work with, but you need to start somewhere. And those people have a network as well, of course. So I contacted them and just said, okay, let's get started. We have the same motivation and we want to change how schools experience the end of life. So we just started to think and work around this. And already just working around it was already beneficial without immediately producing something, because the diversity of people, they didn't know each other that well. Being together, just sharing the knowledge and information was already beneficial for this group. Later on, I got in contact with Sally Paul, who received the initial seed funding for the European Learning Network. And then we just extended our network. We asked people if they knew someone, and especially people who are teachers as well, because as a researcher, you quickly associate yourself with more researchers, and you want to develop something for schools that is applicable to schools and that is appreciated by teachers as well. So that's why, just like in compassionate schools, you're involving the students. Developing something for a compassionate school, you need to involve the teachers who will be using the document that you are developing. So we wanted some teachers to be part of this process, and we succeeded in this by having a number of teachers present, which we highly appreciate because we know how busy their schedules are. But I think it's just about getting started. Look at the people who you know already, who are motivated to do something, and you can slowly build from there. I mean, we have this mailing list. A lot of people are in this mailing list, but not that many people are participating in our learning network. And as I said before, that's totally fine. They're just following along. and maybe starting with their own initiatives. So just start from there.
If I may come in, Bert, it's just to share is that at our university, when we started, we only started with another university college who asked her for input. And what we did, we just started by sharing the stuff we had, the materials we had. And we just say, like, take everything you want, but just contextualize it within your own school. And that really started it. And then after 6 months, a year and a half, we already receive emails from other schools like, okay, we contextualize this, we did that and that of a change. And we also did something else, something new. And that was really fun just to share that. What were your experiences? What were the barriers? What were the facilitators? And that's the fun thing. Just start with something very, very small, and then you can share with each other. And I think that we just met twice a year. We didn't do a lot, just an online meeting, and just shared our materials through email. So nothing professional at all, but that was really the fun to start sharing and to build that experiences and having extra materials in the end. And that was fun for every school. And then we started only professionalizing, if that might be an insight. And then I have another question of Michelle, who is asking, how does the context of schools differ from that of neighborhoods? And what are the unique challenges or the opportunities that arise in adapting the principles of the compassionate community approach to an educational environment? That's a nice question as well.
I'll start and everybody feel free to chip in. I think schools differ in many ways in the fact that often school communities appear more organized, so they have the boundaries of the building. Certainly, if we're talking about children, they often have national curriculum, smaller staff teams, for example. Whereas if we look at higher education, there are multiple curriculums, many more students looking at different things, a wider range of policy because of that. And neighborhoods are also the same. How do you define your neighborhood? So in many ways, schools are nicer to work with because they do have those boundaries around them. But certainly the principles are the same, and some of the things we've spoken about in terms of starting small and starting where you see some of the problems to be, or where you can affect change or interest, is absolutely key. So thinking about our own university here at Strathclyde, one of the things they have developed is a support group for carers, and so building on that, because carers said actually the leave you provide us is rubbish, and actually when the person is seriously ill, like, how do I manage here? What support do you have? And so that was our first introduction to kind of building on some of the principles for schools. Would anyone else want to add to that?
Yeah, I want to add something from my personal experiences in the compassionate schools that we developed. As I mentioned, there's often shortage of resources, especially in schools. Teachers feel already quite overwhelmed, as I mentioned before. So it can be tricky to develop a compassionate school. But I think one strategy we applied was extremely successful. And that is we appointed a teacher trainer, somebody with expertise in the end of life. And this was extremely helpful because teachers sometimes felt insecure to address a certain topic. For example, you can be schooled about the end of life, but then you have a student who has autism and is experiencing an end of life situation. And this again makes teachers extremely insecure on how to handle such a topic. So if you have a direct contact line with somebody with expertise in this, where you can just pick up the phone, make a small phone call, ask them, how would you handle this situation? And they will give you advice and you can go along. This was extremely helpful and appreciated by all teachers that we had in our schools. So it's sometimes you don't want to make specialist counselors or psychologists out of teachers. They have to remain teachers, but you have to surround yourself with a network of people who have the knowledge and that can be consulted. So yeah, I think that was very beneficial for us.
Good, and we're on a roll, so I keep going. And there's another question, and it is, should a bereavement policy be made mandatory for every school in the same way as child protection policy? give bereavement support the same importance as safeguarding?
I'd say yes. Good bereavement support is safeguarding because we know that it's associated with a variety of risks if we don't have the right support at the right time. I'm involved in a research project at the moment, again in Scottish schools, looking at where they have bereavement policies versus bereavement guidance. And actually we were surprised by what did exist, but the feedback from the school staff was that it didn't matter if it was a policy or whether it was just guidance, but if having something there was the most important thing, because especially if it's a sudden death or something that was brought to light that the school didn't know about in advance. It was the document that they went to when they didn't know what to say to parents, if they didn't know what to say to children when someone had died, or if they didn't know how to bring people together. It was a key document for that.
I totally agree with Sally. I would just like to add one more thing from our experience in developing those documents. I was really surprised to see that many schools live on an island. Even within a village where we did our research, the schools were not really connected with each other. When we started to develop a bereavement policy, the schools were actually put around the table, the teachers and other school staff who often had never spoken before. And just by doing this and in a group developing a bereavement policy actually created a lot of cohesion between those groups and broke down certain barriers that existed. They always talked about the competition that existed between schools in attracting students, but they also all talked about wanting to stop that competition. And I think this was a really good strategy in trying to break down the barriers that exist between them.
And if I also can come in, what we also saw in experiences is that simple things that were developed, schools loved it. When it's really straightforward in using the language and they just can contextualize very easily. It has been used for many times, and just the basics were already a huge impact in how to use it, because it's so easy and it can be just very accessible and used on a daily basis. And that's what they really liked it. We have the tendency to be very complex in what we want to develop, but that wasn't the key.
Yeah, I cannot stress enough what Sarah just said. I think it's so important to facilitate the development process for teachers, giving them some activities or actions that have been done before, of course, need to be tailored to their own context, but minimizes perhaps the work they need to put into it and can just facilitate the process of starting to build a compassionate school. I think it's also about building your self-confidence as a teacher that you can do this, build a compassionate school. And we can just facilitate this process a little bit by giving them some ideas, some inspiration.
All right, good. I think if that's okay, I would also like to share a slide or two. But if there are other questions, please put it in the Q&A or in the chat. I have both open. So and now it's not going how I wanted to. So if there are questions, do not hesitate to use it. If it's okay, I would like to share slides about the Compassionate Community Center of Expertise. This is our website, and that's also where the Learning Network of Compassionate Schools is being organized as well. Bert and I, we are coordinating the Center of Expertise in Belgium. So this is our website, and this is what we're aiming to do through research and dissemination and valorization, to put it like that. And I also wanted to broadcast, if you're interested, because I saw already a question regarding debt literacy. I didn't get there yet. I'm sorry, I just grabbed part of your question, but there are also grief literacy seminars. And the next one is on next Tuesday. You see, it's an entire list. It's next Tuesday. They are all online, so you can join and you can register here. You can see it. And it's about the truth and reconciliation, and it's Mary Ellen Macedonia MacDonald who will give a talk. She's coming from Canada, and explain everything regarding grief literacy. And so I'm reading very fast now, but here you have the link where you can subscribe on our website. It'll be, of course, in English, but in European Central Time. And there also, if you're interested within, it is physical most of the time, but we are also organizing a Compassionate Week at our own university in Brussels. We had the one for last year, and now we're having again a second time this year, and we're organizing very different type of activities, from drawing to a poetry slam, a compassionate cafe. And we also have a commemorance moment for the people who have passed away, but also to commemorate or to recognize people who are taking care of seriously ill people. So there are all types of activities, but we have one who will open up to everyone, and that's also on grief literacy, and it'll be in English during that week. So you're very welcome to join. So that's it. And if there may be now watching, if there are other questions, maybe, I don't think so. I will stop sharing. All right, good. So thank you everyone for joining. We wish you a happy afternoon, evening, or morning. And I don't see other questions, or am I? Oh yeah, there is another question. Regarding the Erasmus Mundus master degree of care, but maybe Sally, I don't know if you're into it, you can do it by the chat. So, but
yeah, just commented on the chat.
all right. Thank you everyone for joining, and have a lovely morning, afternoon, or evening.